Well, welcome, folks. This is Chris Jangra here with my wife Tammy Sellers, and this evening we have a very, very exciting call. And I really want to thank you for taking the time and attending this webinar. And Bobby Horn, thank you for joining us this evening. Bobby was our guest actually last week. We had a wonderful, wonderful session. This week, it's actually in line to our technology, but this time is on the quality control and the legitimacy that Max actually applies when it comes to the quality control of our products. And this is a very, very, very important topic because I know sometimes we know that there's companies out there that are making claims that are stating a lot of things, and the facts are the facts. And I think it's important that, oh, sorry, someone is playing with the features here. I'm not sure why, but let me just go back to full screen, and we want speaker view. Perfect. Okay. Let me just go back. So I kind of lost my functionality here for a minute. Okay, perfect. We're back on. So as I stated earlier, we have a very, very special guest. It's a real honor to introduce this gentleman. I had an opportunity to Tammy and I had an opportunity to meet him in person. Many of you did actually when he came in Toronto, and of course in many trips around the globe. Scott Momii is just a wonderful, wonderful individual, very, very modest. I want to read a little bit of his bio so you get a feel for who the gentleman is. Scott was a co-founder of a prominent research, development, and manufacturing company for specialty chemicals. His management responsibility included domestic and international sales, marketing, and manufacturing. He spearheaded the development and launch of three proprietary, folks. As a French person, sometimes word will be a little bit of a sticky word in my mouth. I think you got the process here. You got the meaning. So proprietary.
Proprietary.
Say it again, Tammy, loud and clear.
Proprietary.
Proprietary. I will read that 100,000 times next time. Product in the area of cosmetic, which debuted in Japan, the motion picture film industry, domestic and international, and specialized coating for high-speed ball bearing used in medical applications. He was director of operation in a biotechnology company that developed vaccines and cancer therapeutic based on liposmal and technology delivery system. Mr. Momii graduated with a BA degree from San Jose State University, received an MBA from Boston University, and completed a summer business program in Sophia University in Tokyo, Japan. Scott, it's a real honor to have you here with us, and we certainly want to thank you for taking the time to be with us this evening. Scott, I just want to make sure that you're able to unmute yourself. Are you able to unmute?
Yes, I should be unmuted.
Yes, you are. Wonderful, wonderful. So we really want to thank you for joining us this evening. And Tammy, was there anything else that you want to add before we pass the session to Scott?
No, I'm great. I'm really looking forward to this, Scott. It's been a while since we've connected, and I remember the last experience that a lot of this group members have got to experience at our condo in the party room. And I know you shared so much insight and took our belief level to a whole new level around what we have in the science. So thank you for being here with us.
Yeah, certainly, certainly. And Scott, now you do have the ability to share your screen, but please go ahead and maybe share a few words, and I'll leave you. You have complete control when you feel appropriate. So I'll turn the call over to you.
Okay, thank you. First of all, I'd like to thank Chris and Tammy for inviting me to speak tonight. And also, I'd like to thank everyone for joining us this evening. I'm sure it's been challenging for everybody these past 18 months, but I hope everybody's doing well. I'm located out here in Southern California, and we're just starting to open up, or we were getting back to normal, but then we've been hit by the Delta variant, and things are once again starting to shut down. I hope everyone enjoyed the Olympics. For me, it was a very nice break watching the best athletes in the world compete. So with that, I think I'll go ahead and get started.
Sure.
Let me Okay. Can everybody see the screen?
Yeah, loud and clear.
Okay, great. Today I actually just have 3 slides I'll be covering. One is reviewing the RiboCeine technology. I want to talk about product labels, third-party validation, and manufacturing quality. Even though it's just 3 slides, it's really packed with a lot of very good information. So why don't we go ahead and get started? Dr. Herbert Nagasawa, we know, is the inventor of the RiboCeine technology. And he actually had 2 laboratories. They are considered the experts on the chemistry and delivery of glutathione. He's an emeritus or a retired professor of medicinal chemistry and toxicology. Previously, I had worked at a biotech company, and I worked with many PhDs in organic chemistry, biochemistry, immunology, and even physical chemistry. But I had never heard of a medicinal chemist, so I had to look it up. And it was very interesting for me to find out a medicinal chemist has to have training in biochemistry, organic chemistry, pharmacology, and toxicology. All these different disciplines rolled up into one, because these are the individuals that create compounds used in treating different diseases. And Dr. Nagasawa was a pioneer researcher on glutathione starting in the early 1980s. And to put it into perspective, today there's over 160,000 published articles on glutathione. Back when Dr. Nagasawa was starting, there were only about 8,000 published articles on glutathione in the 1980s. As I mentioned, he had 2 laboratories, one at the University of Minnesota and the other at the Veterans Affairs Medical Center in Minneapolis. And he had a number of different PhDs working under him. He was very concerned about the veterans because of drinking problems many of the veterans had coming back from the Vietnam War. And he knew that this drinking was very bad for the liver. And his theory was if he could provide glutathione back into the body, it could help protect the liver. He had to figure out how to do this because he knew glutathione itself was not very bioavailable. And so he solved the problem through chemistry. His thought was to try and deliver cysteine back into the body so that it could create glutathione. But cysteine is very reactive. And once it gets into the stomach, like glutathione, it oxidizes and is no longer of use. But he created many, many different compounds of cysteine. And it turned out that RiboCeine provided the best bioavailable protection of cysteine of all the compounds that he tested. And this compound we know today as it's in many of the Max products. Currently, there's 41 published studies on RiboCeine, which includes 6 new studies published in 2021. So this is just a brief overview of the RiboCeine technology, the science, and everything that went into the development of this technology. So next, I'd like to talk about product labels. And there's a lot of very good information on product labels. You may have noticed in the past year, the supplement facts panel has changed. And what happened was in 2020, the US FDA issued new guidelines for the supplement facts panel. And this was the first update to the supplement facts panel in 20 years. Over on the left side is the old Max or Celgevity label that you're probably familiar with. One thing you'll notice is the percent daily value has changed. The FDA updated the percent daily value to reflect the new dietary habits of the American consumers. The other thing you may notice is how they describe the botanicals. Before, we would just list the ingredient, but now the FDA wanted more information. So we have to include the ingredient name, the scientific or botanical name, and part of the plant used. So one other interesting item I'd like to point out are what's called branded ingredients. And these branded ingredients are special ingredients that manufacturers have identified with their ingredients. And they feel these properties are very unique, where they may have higher potency, better absorption. They're of very high quality and consistency. Generally, the proprietary manufacturing process, it's proprietary to the company, generally patented, and they'll trademark the name. And, and they'll invest a lot of money into studies showing the benefits of their ingredient. And there's actually, outside of the RiboCeine, 4 other ingredients. They're curcumin or Meriva, broccoli seed extract, True Brock, the aloe, bialoe, and the black pepper extract, bioperine. These are all very high quality and respected ingredients in the industry. Dr. Nagasawa specifically was interested in one ingredient, the broccoli seed extract, or True Brock. He saw their science out of the university, or Johns Hopkins University School of Medicine, and he felt it was very synergistic with the RiboCeine technology, where they showed the detoxification effects of broccoli seed. And it had very good science. And he felt it was important to include this ingredient in the Max products. And it can be found both in Celgevity and Max Infuse. One other thing I wanted to mention is during these COVID times, there have been many delays and shortages of the components that go into the different products. Just to give you an example, last year, we had a problem getting our labels printed up. And we found out that there were, believe it or not, hundreds of millions of new labels that were being produced. And it was for hand sanitizers, of all things. And this is, one example of the shortage problem that we had. The other thing you may notice, some of the lids used on the products appear slightly different. They may not have the Max logo, or some of them are rounded. And again, this is due to shortages. As it turns out, there's a backlog on getting the logos printed for up to 6 months. And some of our products, we just couldn't wait, and we made the decision, Scott Nagasawa and myself, we review all of the specifications for any change and make sure that there's no compromise. And so we made the decision to allow the use of these slightly different lids. But that's just a few of the problems that maybe you don't hear about behind the scenes. And even though there's these little changes that you may see, and even the supplement facts panel has changed, there have been no changes made to the Max formula or the Max products since they've been introduced. Next, I wanted to talk about RiboCeine itself, the ingredient that Dr. Nagasawa had created. It is patented and therefore proprietary to Max International. The RiboCeine name is trademarked, not only here in the US, but in many countries around the world. The manufacturing process was actually developed by Dr. Nagasawa, and he starts with the highest quality ribose and cysteine available. Um, we collected all of the information on the different ribose and cysteine available at the time, and he identified the highest quality ribose and cysteine available on the market. And the RiboCeine is manufactured under the same conditions as a pharmaceutical product. Very few dietary ingredients are manufactured to this high quality standard. We use US FDA approved pharmaceutical manufacturer, and it's manufactured here in the US. Dr. Scott and myself, it's our responsibility to review the manufacturing process. All batches are tested according to specifications set by Dr. Nagasawa. He set these very tight specifications to make sure every batch was actually RiboCeine of the highest purity without contamination from microbial or heavy metals. In fact, if you can believe it, we have rejected some batches of RiboCeine that have not met the release specifications. This is a very expensive process when we do not accept a batch because it didn't meet the standards. And as I mentioned, there are 41 studies now using RiboCeine. The next logo is the Banned Substance Control Group, BSCG. And this group specializes in testing of banned substances. They start with the World Anti-Doping Agency list, or the WADA list. And they actually test not only for banned substances, but also for prescription, over-the-counter illicit drugs. They conduct almost 500 different tests on every batch that contains this BSCG logo. And it's halal certified by the Islamic Food and Nutrition Council of America. They're an internationally recognized organization. They have audited, physically visited and audited our contract manufacturer. And every year, all the batches of the previous year are audited and reviewed to make sure they follow their standards. Gluten-free and melamine-free, this is a Max internal policy where we want to make sure that the product doesn't contain gluten or melamine. We review all of the specifications of the ingredients, and we know they're not supposed to contain gluten and melamine, but this is just an additional test that we do. We randomly select products, all the Max products, and send them to a laboratory that specializes in testing of gluten and melamine. The FDA set as a limit no more than 20 parts per million of gluten. And then for melamine, if you're not familiar with melamine, it's a substance that is illegally used as a filler, showing a higher content of amino acid. But this substance is very toxic to the kidneys. And our standard is no more than 2.5 parts per million. Finally, on the bottom of the bottle, you'll see expiration date and lot numbers. So we actually test all the Max products to show that there's a 2-year stability date. We send the products to a laboratory that specializes in stability testing, and they test to make sure our label claims are correct. That at the end of 2 years, if we say there's 4.25 milligrams of vitamin C, that there is a minimum of 4.25 milligrams of vitamin C at the end of that 2-year time frame. So there's actually a lot of very interesting and good information that you could find on product labels. So I did talk about third-party validation. And this is very important because just like the studies of Max International, this information is validated by experts in their area without having any input or bias from Max International or the company having them tested. So the next third-party validation that's important is our contract manufacturer is audited by different companies, and it's called a GMP certification, which stands for Good Manufacturing Practices. And this is a manufacturing quality standard set by the FDA, which includes manufacturing consistency, quality controls, record keeping, and testing to make sure the products are safe for human consumption. Max uses NSF International. There's many different companies that audit, but NSF International is known throughout the world as having one of the highest standards for GMP certification. Next is the Australian government, the Therapeutic Goods Administration. Our manufacturer is actually audited. They come out all the way from Australia and do an extremely thorough review and audit of our manufacturer. And the Australia TGA is also known as having one of the toughest standards for producing dietary supplements in the world. And finally, our products are registered in 18 different countries, and every country has different standards for reviewing and allowing products to be sold in their country. They want to make sure that the products are safe for consumption for their population. And every country looks at different areas in showing that the product is safe. But by having so many different countries review the products and the audit of NSF showing it's GMP compliant, we know that the quality of our products has been uncompromised since when Max first started selling the products. So this is a very quick overview talking about the science behind the Max products, the some of the quality that goes into the production of the Max products, and how we review and certify that the products are what they're supposed to be. Thank you very much.
This is wonderful, Scott. Thank you. And we have a few questions that popped in. And I guess, folks, just for a bit of protocol here, if you do have some questions, I'm happy to unmute you so you can actually verbally state your question, and you can actually just raise your hand. So if you do that, I will just make sure that you are unmuted so you can go ahead and pose your question. So at this point, Scott, if you want, you could release the share screen. Just press the green button again at the bottom. And at that point, it will give me back control. So we can, I can actually organize the screen here. Okay, beautiful. Okay, so let me go back to speaker mode. Okay, perfect. Excellent. Okay, thank you, Scott. This is absolutely wonderful. So Bobby, I know you actually sent me the question privately here, so I'm going to let you verb it and share with everybody your question. Just one moment here. So you should be able to unmute at the moment.
I think I'm unmuted. Is that correct, Chris?
Yeah, you are good. Please go ahead.
Okay, perfect. Scott, is lovely to see you again. One of the questions that I get from health professionals is about the soy lecithin that's included in the capsules. Would you please explain to everyone why soy lecithin is included and what it does?
So the soy lecithin is what they use are other ingredients that allow the product to be encapsulated. So in order for the products to be encapsulated, sometimes if they're too fluffy, then it won't flow nicely. So they use these ingredients that are excipients that have been reviewed and tested or reviewed by the FDA, showing they're safe. The soy lecithin, that is an ingredient that is used as what they call a lubricant to help the flow of the powder into the capsule. We have researched other types of lecithin, for example, a sunflower lecithin, but we found out that the supply is not reliable at this time. So the soy lecithin that we use is by a very reputable manufacturer, and they minimize the amount of soy that they can. Soy is very prevalent, and what happens is some of the soy is made differently, and they try to avoid any of the soy that's not made in the proper manner, but it's just too prevalent. They do the best they can. So at this time, we know many people are do not care for soy. It is a warning on our ingredients, and it's something that we're aware of, and hopefully we'll be able to change that ingredient.
One of the things I know, Scott, if you don't mind me just kind of adding on there, Scott Nagasawa has spoken to a couple of physicians who had a concern about this. And what he discussed was the fact that the amount of soy lecithin that was included was so minute that even somebody with a soy allergy, it was extremely unlikely or rare that that would have any problem. Is that correct?
Yes, that's very correct and a good point. We use very, very small amounts. We try to use the minimal amounts that we can. So the product is as pure as it can be.
Thank you, Scott.
Thank you, Bobby. Sorry, I was answering to some of the other attendant as we were going here. Really appreciate the question, and thank you, Scott, for taking the time to answer. Next one, Jasmine, I'm going to go ahead and lower the hand and give you access. So please go ahead.
Awesome. Thank you so much, Chris. And thank you, Scott. Great to connect with you and see you here again. So thank you for your time. I just want to continue with that which Bobby had presented. And that was that I've had some questions about the soy raising estrogen. That's why I heard that some people didn't want to take it. Can you comment on that before I go to the other questions in relation to any concerns with estrogen imbalance or increase from the amount that's in there?
That one is a little bit beyond my expertise. The only thing I can say is that there's very little soy in the product. I'd be surprised if it has an effect, but again, that's not my area of expertise.
Okay. All right. Okay. Thank you. And the questions that I had was, when did you start working with Dr. Nagasawa? How long have you been part of the Max team?
So Max purchased our company, Celgevity, in 2009. I had actually been working with Dr. Nagasawa and Scott Nagasawa 3 or 4 years prior to our being purchased by Max International. So when I first was introduced to Dr. Nagasawa, um, I was working at a biotech company and very happy. Um, but I saw his technology and I looked at his background and I really liked it. I could tell that he was an extremely thorough scientist by how he conducted his research. Um, I've worked with a lot of very competent, very special PhDs, but there was, for me, something special about Dr. Nagasawa. And when I looked at what he was doing, which is working with glutathione, which at the time I didn't know what it was and had to research it, and I was very astonished at how important it was to our overall health. But I also looked at his approach of using natural compounds that are naturally found in our body. And that was really unique. And this was something that I wanted to be a part of. So that's when we started the company. Following that same line of thought, I'm not sure if many of you are aware, but Dr. Nagasawa has developed a cyanide antidote. And he used the same philosophy of coming up with an antidote using natural components that are found in our body, not foreign components. And it was also very new to the FDA to have this type of antidote. And it took a while for them to understand because it's naturally found in the body, how the body reacts to it is differently than how it reacts to a foreign substance like a prescription.
Right.
So they were able to finally get the FDA approval, and it's the first cyanide antidote that can be given proactively. He wanted it for the soldiers that may encounter it in the field, but also for firefighters that when they go into the burning buildings are exposed to cyanide. So that was, for me, a very interesting philosophy that he has tried to follow and has successfully followed.
Yeah, it's unbelievable as you share not only his brilliance in science, but the level of compassion that Dr. Nagasawa has for humanity. Like it's just, he really is a rare, just such a special individual. Like we're so blessed to have him in our circle, that the work that he's done has influenced all of our lives in such a positive way.
Yes, yes. And I've heard from many of his former colleagues, and they have nothing but the highest regard for Dr. Nagasawa.
That's wonderful. And one other question, is there anything that you're stirring in the lab? Like, are we going to specifically stay with glutathione? I know that that's obviously, we've got the world market on that with the technology, but sometimes people ask me, are we going to do anything with probiotics? Is that something that Max is looking at? So I'm just going to put that out there.
So, Max is always looking at new and innovative technologies. We constantly review different technologies. The decision, which direction is outside of my area. But, for myself, I still feel that we've just started to scratch the surface on glutathione and what it can do. And what you're finding, or what we're finding, is that as more and more people understand the importance of glutathione, we do find more competition out there. And I think it's only going to, we're just going to see more and more competition. But when I first started with Dr. Nagasawa, I felt that that's what would happen, but I also felt that the way that he solved the problem through chemistry, that that was the correct way. And it's going to be very difficult, if not impossible, for someone else to come out with a better delivery system.
Absolutely. Absolutely. Of course, when you've got the best out there, there are always people that will try to chase it, but that's all they're doing is chasing it. So thank you so much, Scott.
Which is not a bad thing, you know,
Oh,
because it helps
absolutely.
educate people on glutathione.
That's right. It's exposure and it's educating them. Thank you again. It's always an honor to have you with us. Thank you so much, Scott.
Thank you.
Back to you, Chris.
Wonderful. Thank you, Scott. Thank you, Jasmine. It's, you know, it's wonderful when you put educated people together, how much information surfaces to the top. It's I just love it. And this is the goal of these calls, is to get that information that it's hidden in the science and to the standard of doing things. And sometimes we forget what we have, and that's the reason why these calls are here, to bring back into perspective what it is that we offer to the inline consumer. So I'd like to pass this over to Barbara Ann. I believe it's Barbara Ann, or maybe it's Paul. You have a question, so I will unmute your line, lower your hand, and please go ahead. Oh, what did I do?
So, okay, are we good now?
Are you guys there?
I think so. Can you
Okay,
hear me?
cool. Good. I
Yeah,
thought
good,
I came
okay,
by
good.
mistake. Okay, please go ahead.
Yeah, hi Scott. Great stuff. Really enjoy your delivery. That's quite concise and easy to understand. We work with a lot of athletes, and Max has the BSCG certification, which is terrific for the athletes. We also have NSF certification, which is terrific. But I have been asked about NSF for sport as opposed to NSF. And maybe you could tell me the difference so I can address these folks, because it seems to be an impediment to entering a couple of the areas where these guys can actually use our product. They love the product, they like the science, but it's missing the NSF for sport certification, and it's keeping us out.
Yes, so the NSF for sport certification, it's another very high quality banned substance certification program, very similar to BSCG. It's just there are two different companies. For me, either one is excellent for the athlete to know that there's no banned substances. You know, NSF, I've actually visited their laboratories in Ann Arbor, Michigan, and they are just the state-of-the-art laboratories. And, you know, I always enjoy working with NSF, and I know whatever their logo is on, that it's a quality product. But at the same time, you know, I also feel that the Banned Substance Control Group, BSCG, they're on the same level as NSF, and the athletes can be very assured that there's no banned substance in a product that has a BSCG logo. If you'd like more information on BSCG, I'd encourage you to look at their website. They're constantly updating their list, as is NSF. For when new banned substances are found, they add that testing. But there's many of the same organizations that endorse NSF for sport, also endorse BSCG. So I think both programs are just outstanding.
Yeah, don't disagree on that. However, because of the lack of NSF for sport, whether it's equivalent, better, highly recognized, the doors are closed because of that lack of the NSF for sport certification, and they're huge markets. So I guess my question is, you know, I don't know the costs of doing these things. I don't know what the prohibition is on doing these things. Is it possible to look at the NSF for sport to open up, especially North American market?
We can bring that to the corporate attention. It's a major commitment if the company were to move to another certification program. To me, they're both equally good, but there's a lot that goes behind it, and that's a
Yeah.
decision that's above myself.
Excellent. I just thought I wanted to bring that up, Scott, and make it.
Yeah,
you know,
no, it's
on
good
the
to get
table.
input like this. It's always
Yeah.
good to get input.
Excellent. Thank you very
Thank
much.
you.
Thank you, Paul. Thank you, Scott. Okay, so we'll move it up down to Paul. Paul, I will unmute yourself with your hand, so please take it away.
No, thanks, Chris. Scott, I just want to say thank you so much for the great presentation. Very impressed, and I haven't seen you for a while. It's been 18 months we saw you in Toronto, so good to see you now. I'm moving away from the longevity right now, just to the Enfuse. Maybe you can elaborate a little bit on the Enfuse. It is quite sweet, and I know it's natural. And I just want you to, would you mind elaborating on the sweetness and the fact that it's good for diabetics and things like that? Because I get a lot of questions on that.
Yeah, so Max Infuse, that's a very nice product. I do take it myself every single day. I like it because it provides the important vitamins and minerals, but it also provides our important antioxidants. So regarding the taste profile on the sweetness, it is something that uh, Max is aware of, and they do try to minimize the sugars that are used. So one of the main sweetener ingredient is fructose. It's
Yeah.
not the what was it, the um, high fructose content that is used in many of the uh, products, candies, and sodas. But this is a more pure form, more of a natural form, and doesn't have that high index. So yeah, we do try to balance that, have a nice tasting product, but also concerns about the diabetic. And that's a question that we have gotten over the past, and it's something that the diabetics shouldn't be concerned about.
Thank you so much, Scott. Really appreciate it. Thank you.
Okay, thank you, Paul.
Thank you, Paul. So at this point, we'll go over to Sylvie. So Sylvie, I'm just going to go ahead and unmute your line. So please go ahead.
Okay, thank you, Scott, for being there. I'm on the, I had a question too about the Enfuse. I've been hearing a lot of associates using like the our Enfuse vitamins or like the nanotechnology. And I wanted to clear that out. I'm not sure what that is, and can we apply it to the Enfuse that we're using? And how do they really compare to other vitamins that are on the market?
So nanotechnology, that encompasses a wide range of technology. And I think there's different ways of how people go about to nano size or make their products smaller. You know, for us, we like to see the scientific studies on the nano ingredients. You know, what exactly does that mean? I really haven't seen it that well accepted in the dietary supplement industry. It's something, you know, that we're very in touch with, but I think there still needs to be some science to really show what its benefits are, how much of a nano-sized vitamin equals regular vitamins. I haven't seen those type of studies. And then in many of the international countries, the nano technology is still very new and not accepted. So I can't really comment if it's good or bad or more efficacious. We're just really waiting to see more technology so we can better understand it.
Okay, and what about the absorption, like of the vitamins? Because that's always the big topic about comparing like vitamins to another. They say like the low grade vitamins, we're probably flushing most of it out, but how do our vitamins compare?
So let's see. So regarding our vitamins, the vitamins are like, how do I say it? Yeah, I've heard that before where people say, the body doesn't necessarily absorb or the body flushes it out. But, our vitamins are very high quality. And for us, we have seen many of the studies, reviewed the studies on the vitamins, and we do feel our vitamins are very well absorbed into the bodies.
Okay, all right, thank you.
You're welcome.
Thank you very much. And these were wonderful questions. And remember, folks, I mean, I'm not a scientist, but I've been around network marketing for a long time. And when it comes to marketing, they will use absolutely anything that may sound attractive or sexy, but does not necessarily measures up. And the one thing that I know in reference to this, the nano size compared to what I was made to understand, from my point of view, if I may just add, Scott, is it may take a little longer to absorb because it's not nano size, but it still goes through the bloodstream and it still goes in the system. And I still feel phenomenal when I take the Enfuse. And I've been using it not for a month, not for a year, but over 10 years. So, I mean, at the end of the day, you got to turn around and say, okay, well, good for you. And but we also have the test of time, right? And so I think that Max has proven itself over and over and over and over and over and over. I can go nonstop here, and to the legitimacy of what it is that we bring to the table. But I love the questions because it brings into perspective some of the questions that maybe are left unanswered with people out there. And Scott, Tammy and I really appreciate you because I know I kind of caught you a little bit by surprise, and you made yourself available very quickly to be available for this call. And I want you to know that we really do not take this lightly. We really, truly, I speak on behalf of the team here. I know these guys. We really appreciate you and appreciate your time spending with us here.
Thank you. Yes, it was very enjoyable. Appreciate all your efforts in providing good education to all the associates.
Yeah. Now, Bobby, I noticed you have your hands up. Did you want to go ahead and unmute yourself?
I think you can hear me now.
Yep, you're good.
Thank you so much, Scott. I just wanted to let everyone know that the next medical education piece that we're going to present will include both Scott Nagasawa and Scott Momii. And you guys are in for a treat because they're going to be talking about product formulations. And I've had an opportunity to review the information, review the PowerPoints, and it's just outstanding information. So, Scott, I'm looking forward to you sharing that.
Okay, thank you.
That's wonderful. Thank you, Bobby. Thank you. Tammy, did you want to add a few more of your thoughts before we end this? I believe Scott, I just said. I'll come to you, Scott. Please go ahead, Tammy.
Every time I hear how powerful our products are, the only thing that goes through my mind is we have such a huge market that we need to get these products into. North American market has literally been untapped. And it's just a matter of us all making that decision, wake up tomorrow morning, how many people are we going to impact with our products? So thank you. We really appreciate what we have in our hands. We're very grateful for Herb Nagasawa's technology and for you guys and what you're doing to help get this to the world. And team, it's up to us. we're the ones that we're the networkers to get this out there.
Yeah, thank you, Tammy. I believe that Scott Henderson just dropped, so maybe it'll come back in. And at the end of the day, folks, here is this, and as we end this call, you probably noticed the last two calls were very strong on the legitimacy on our products, our science, and also how they're being treated and quality control, and give you the sense of confidence of what we have to offer. And remember that Max International, they are fabricating, let me rephrase that, they are distributing products that are fabricating by the professionals associated with the Nagasawa family and Scott Momii. But at the end of the day, what are we? We are a distribution network. Without us, nobody would know about the Celgivity. Nobody would know about RiboCeine. Nobody would know about glutathione. That is what network marketing does. It educates people. It helps people understand what we have to offer. It also helps people to afford these products because they get compensated for telling others about it. And the goal here is to establish credibility so you can use that as tools to help someone that might be very skeptical. And I find that the best tool against skepticism is education. And if they choose not to see, well, that's fine. Just love them where they are. But I'm telling you, education is the best ally you could ever ask. And that's what Max International has. They pay extremely well. And over and above that, with cherry on the cake, we travel in exotic, beautiful places. I mean, where can you possibly find this kind of combination? Science-based, credible, anecdotal stories, great income, and traveling around the world. So, Scott, I know you have your hand up, so I want to give you an opportunity. I noticed you came back. Please go ahead. Oh, yeah. Are you there?
Hi, thank you, Chris. Can you hear me?
Yeah, loud and clear.
Okay. I know the subject have moved on to a closing, but I just wanted to weigh back in on the Max Infuse and the quality control for the products because, Celgivity Max 1, all of it. I was fortunate enough at one of the conventions to sit beside our president, Jim Stravilla, and we had a conversation in regards to the BSCG certification, and part of the requirements to uphold that certification. And he mentioned all of our products, all the raw ingredients that go into making up our products need to be scanned for impurities, scanned at the nanoscale for impurities. Maybe you can weigh in or maybe confirm this for the certification.
Yes, so what happens is all of our ingredients, when they come into the manufacturer, there's testing criteria. So first they test to make sure the ingredient is what it's supposed to be. Then they test to make sure there's no contamination of heavy metals or microbial contaminants. They're all quarantined until they pass the testing. I'm not sure what he was referring to on nano testing, but there's the testing that we use is industry standard. It's well accepted, and it's what they call validated testing. So these validated testing means that it's been certified by a number of different agencies showing that it is doing what it's supposed to, and it can be truly replicated. Yes, all our ingredients are tested, and then it'll go through a similar but more detailed testing process of the final product before it's released. We do Dr. Scott and myself receive all of what they call certificate of analysis on every batch. We review them prior to being released. So there's quality standards set throughout the entire production process.
Perfect. Very impressive. Thank you.
Thank
Appreciate
you.
it.
Thank you, Scott, for your question, and thank you, Scott Momii, again for your time. So as a close here, we're exactly 9 p.m. Eastern. Scott, again, thank you for your time. Really appreciate this, and we really look forward to invite you again. And we actually look forward to the symposium that Bobby was talking about. So thank you.
Okay, thank you. Thank you very much. Thank you, everybody, for joining today, this evening.
Wonderful. Wonderful. So, folks, let's show our appreciation here for Scott Momii on the comment section. That would be appreciated from you. And or just through some hearts or some clapping, or all of these things are very appreciated. And I wanted to remind you that the call is recorded. It'll be available on the activeteamtraining.com domain. It points to the YouTube channel that have all of the trainings. Don't forget to subscribe so that way you get notified every time we upload a new training. Okay, so everybody, thank you so much. Have yourself a wonderful evening. And again, Scott, thank you so much for your time. Have a good night, everyone.
Good night.